It's just the greatest gift that you can give, to care for your fellow person. To me, that's the way I was raised. And I feel like that if we did more of that, then what a wonderful world it would be.
Our mission is to prevent pain and alleviate suffering by providing free quality health care to those in need. We primarily operate through what we call pop-up clinics. We come into local communities, we partner with local communities and set up in different types of buildings. This weekend we're in a school, and we set up dental, vision, and medical areas and provide those services free of charge to anybody who needs them. We have the capacity to provide dental cleanings, fillings, and extractions, vision exams, and we fabricate eyeglasses for our patients, as well as basic medical exams. We are also fortunate this weekend to have the participation of Appalachian College of Pharmacy, who will be on site providing a full pharmacy for our patients.
And this doesn't cost a thing, nothing. It's all free health care. It's making sure you get all of the services that you think that they could possibly want. Dental, we pull teeth, they'll fix cavities, they'll clean their teeth. Optical, we grind their glasses, we'll check them. We also check their hearing and provide for these services. Medical, we do women's health, men's health. We do lab work. I mean, it's everybody working towards the betterment of the patient.
I am always so grateful as I look around and participate in these operations, not only for the opportunity to be here and to provide these care for people, but just to see the difference that we're making both in the lives of our patients and in the lives of our volunteers. And they're getting to see parts of the country and people that they would not otherwise get to interact with, all in the name of helping people that might not have access to a doctor get the care that they need.
I'd say we have probably about 400 volunteers.
So the local horse organization here, primarily run by Frannie Minton and Sandy Stiltner. They are an absolutely wonderful pair, and they've been doing it for over 20 years. They are a delight to work with, and they always have amazing food.
I co-chair the event for RAM here in Buchanan County with Frannie Minton. Me and Frannie work together on it, so we talk quite often every day. This is our 21st year of having RAM in Buchanan County. My role with the clinic this weekend and ever for the last 21 years, I've been involved with the reservations for hotels at 2 of our local hotel motels, getting the food for all of our volunteers. It's come to like 7 meals throughout the event. Supplies, advertising, billboards, all the way down to getting the porta potties and the street sweepers when it's all after the fact. I have many little roles of making sure everything is done and completed and we have it in place. The first clinic that we had here, the first lady that came in needed glasses, elderly lady that stood up all night long at the door to come in, and she had duct tape around her glasses because they were broken. That broke my heart and I cried. That was it. It'll break your heart. You're just stuck. You're there. You're involved with it. You can't turn back.
So our primary goal, of course, on the first day of the clinic is just seeing patients. So we are, on Saturday, we typically start arriving, at least our core volunteers and our staff start arriving at around 4:15 in the morning. And our general support starts arriving at around 5, and then the docs around 5:30 or 6, and we open doors to patients at 6 a.m. and then we see them until our goal is to have the docs finished up by 6 p.m.
I'm the volunteer registration corps lead, so I run the volunteer registration table that you see behind me. So basically in the morning when all the volunteers show up, I'm the one who gets everyone registered. It's helpful to have volunteers registered for the clinic just because that the way they're in RAM's system, it helps with tracking everything. It helps with just keeping records on everybody and seeing who has been where. There's some safety reasons behind it as well. So when volunteers come in the morning, basically sometimes it's as easy as I type in their name and just click a few buttons and print out the badge and just instruct them to find the volunteer coordinator, help them find a shirt and show them breakfast is ready, just things like that. Sometimes if they haven't registered in advance, I will need to help them get registered. So host groups are really important because in order to organize this clinic, you have to have a host group collab with RAM in order to set it up. And so it's very important to have a good host group in order to have a good clinic. I think this is an excellent host group they have here at Grundy. They really think of everything. They resolve all the issues that arise, and they take care of us really well. I mean, food for one is amazing. Great things. So a lot of good people here in Grundy that organize this clinic. So can't be more thankful, and I'm sure the patients feel the same as well. So.
Right now I'm in the parking lot, so I'm a parking attendant. So what happens is patients check in at the bottom of the hill and they receive two numbers, like a car number and a patient number. And they then come up to this particular area. We enter their numbers into the system and then we park them. And then some people who need like transportation, who have trouble walking and feet problems and stuff like that, we then have them go in the GOAT cart and we take them down to the building once their number is called. So I'm actually a law student, like 10 minutes down the road here at the Appalachia School of Law. So I'm also an ambassador, and I think volunteering is super important, and it actually is mandatory for law students. So I actually wanted to do it last year when I was a first-year law student. The time just didn't permit. I figured this is the opportune time to volunteer, because it's super important to me. And this is the first time that I've actually been familiar with RAM, and I've always seen locations where people are like standing outside. They're like, this is a really great program. We haven't been to the dentist or to vision in like 10 years, and we need the services. And this is the opportunity for them. And if this is the opportunity for them, I'm here to support the best opportunity they can give. I'm a volunteer professor from the University of Buffalo Dental School, and I bring this dental students down and help so we can help out more people, and it's a win-win situation. They get more experience and it inspires some I think hopefully some giving back in the future of their careers. And so I think right here in Grundy, we started here 21 years ago. In fact, it was the very first RAM that was here, and it was the very first RAM that I brought students with me to a RAM and started that whole process of volunteering with a student. This gives me joy, where I do fun things, but you can't beat helping people out and seeing them and really making their lives better. It really comes down to dentistry is expensive, and when you have access to something that is free and it's just amazing to make the differences it can make in people's lives. I mean, why not? I know there was fear in general for dentistry, but I think coming in and having the thorough and all the extra stuff that we provide here, glasses and cardiology, whatever we can bring to the forefront, it's a massive way to improve your health, and so why not? That's why I'd say, please help yourself. Sure, number of people on public assistance, and the very small numbers of professionals that help them in these communities, and so they really have a big need, especially because of the lack of fluoride in the drinking water, and they culturally like to sip on soda like Mountain Dew, Dr. Pepper, all day long, and so it really is tragic for their oral hygiene, and then with their oral hygiene going downhill, then their general health goes downhill. So it's a massive problem that keeps on spiraling out of control. Diabetes, heart disease, and so a lot of it's coming from right down to the oral cavity being a problem.
We're Daughters of the American Revolution, and we're making sandwiches for patients who've been here all night waiting for services. These bag lunches are free. They have no expense whatsoever. The community has donated whatever is needed for the lunches. We're making peanut butter and jelly sandwiches and cheese sandwiches. And then we have, we've got some snacks. We've got cakes and we've got nabs and I don't know what else is over.
Lots of goodies.
Lots of goodies. This is the third year that our chapter has supported RAM Project. We didn't really realize that this was a need that we needed to do till the first year we did it. Frannie is our regent and she is very much involved in RAM, and she said, I need you girls to do this for service projects, and so we did that, but it doesn't matter if Frannie does it or not. From now on, we will be involved. It gives you a good sense that you're doing something that makes a difference to people that can't afford, and they have to depend on services like RAM.
I'm an optician by trade, but this weekend I was our Vision Lab Corps, which means I kind of coordinated and ran our volunteers on the lab truck. If you're a patient that's needing help, needs help seeing, we're going to bring you in. We're going to register you. We're not going to ask you about insurance or anything like that. Our vision area starts out with our exam area. We do full pre-testing where we're going to see what's in your old glasses. We're going to check and see kind of what the machines say your eyes need. Then we're going to sit you down with a doctor. The doctor is going to ask you which is better, one or two, finding out what prescription you really do need. We're also going to look at your eye health. We're going to look at the back of your eye, make sure that you have healthy eyes in addition to being able to see well once we get you glasses. Once we get done with you on the exam, we bring you over to our dispensing area. Our dispensing area, we will generally have 200 to 300 frames sitting out and ready for you to pick out. These are nice frames. They're not just kind of cast off frames. Some of the frames I've used in my office before, and they're very nice frames. Once you pick out a frame, we're going to do one of two things. Some prescriptions we're going to send home to our lab to take care of because it's a really high prescription or it's a particular type of lens that we need to do that we don't keep in our lab here in our truck. Now, if it can't come out to the lab for a truck, we're going to put it in a tray. We're going to get some measurements from you so we make sure we lay everything out where it's supposed to be. We bring it out to our truck. Our lab truck, we have a lens stock in there that will pull lenses. We'll kind of line up the lens. We'll trace the frame, make sure that it's got that set up and ready. Then we're going to take that lens and bring it down to the shape of the glasses. We're going to put the glasses together. We also inspect them. We do live up to Virginia requirements for inspections, and we have a licensed optician who inspects them to make sure they're right, they're good quality for you. Once we get done with that, we bring them back into our dispensing area. Our dispensing area is going to reach out to you and say, hey, your glasses are ready. Let you come in. We're going to put them on you. We're going to make sure that they fit well to you, they're adjusted well, and then we get you a case, and then we tell you, hey, thanks for coming in.
To have this type of service for RAM to come in our community and offer these free services to the area residents is just a great thing. There's a lot of people that need that kind of help that wouldn't get it on a normal basis. So it's a wonderful service for us. The whole process took about 2 hours. They got us in, sat us down. They had somebody to escort us to each and every area that we needed to be in. And we got a brand new pair of glasses made right there on site, which was impressive.
We take roughly 70% of our sensory input comes through our eyes. We can change people's lives by helping them see. That's why I'm at this clinic, because I get to help people see. I get to change people's lives. I get to change how they fundamentally deal with the world by helping them see.
Well, it's a great thing. It just tells you there's still a lot of good in this world. There's still a lot of people that are willing to step out there and go that extra mile to take care of somebody they don't even know.
Social Services is helping out with RAM today. We volunteer every year. This year we are just here to answer questions like if they want to know about food stamps, Medicaid, Like right now, we're just giving out free tote bags, and we do have free clothing. The reason we participate, our county is just a small little county, and anyone that can help participate, and we're just so grateful for RAM coming here each year to help our clients in our county. The industry here at Buchanan County is mainly for the gentlemen, for the men, is coal mining. That's been a thing for our county for many years, from the time I've been raised. My dad worked in the coal mines. Basically for women here in this area, you know, we have like social services, the VEC office, the unemployment office, and then like restaurants, but I mean, we do not have a lot of local businesses, but we do have some. With the food stamp program, the work requirement, our county is exempt from that program. Most counties have to work to get food stamps, but where we have so less jobs in our community, that is not a requirement in Buchanan County. I tell the clients when they come in that someday, I could be that person on the other side of that desk. I may need assistance. Never feel ashamed or embarrassed, because that's what we're here for. That's what the government is here to help. If they need assistance, then they need to, just do it, honor it, and we'll get them through it and help them get the help they need.
They were all very professional down there. The dental students. They're really hands-on with and they're letting you know what they're doing and getting your teeth taken care of. It was quick and professional. Being here and seeing how everything comes together and the coordination of everything that's going on, it's a breath of fresh air for me compared to the situation that I was in this time last year. I've got a chance to shine and show my community that I'm ready to move forward with my life.
My role here at RAM is to help our patients get their medications completely for free, provide immunizations, and do A1C testings for our diabetic patients. Well, to me, it's very important to give back to our community, because being from Buchanan County, we are an underserved population, and one of my duties in life and my goals is to give back to our community, and so RAM is just an extension of our job. And that's our vision statement and our mission statement at Appalachia College of Pharmacy, to provide medical care completely free of charge to our underserved population in the community. Well, being from Buchanan County, I always say we're like brothers and sisters here. And so my grandfather always said, nobody cares how much you know till they know how much you care. So I like for everybody to know how much we care about you all and how we're here to help you.
Yeah, so I've been helping set up the food, like before people come in and get their meals, setting that up, and then I interact with some of the volunteers. I help them pick what they would like, offer up the whole variety, of food that we have, and then help with the cleanup duties as well. I think it's something that's so special. This is a smaller town, and I think it's beautiful that people from all over are willing to come and help and give back to the community.
It's very gratifying. You're helping, you're giving back, and you're meeting friends, you're meeting people that you get to work with and share your life stories, and because there is a little time for reflection. Clinical support is great, there's no question there. We have what we need, and there is a lot of collegiality of the Grundy volunteers. It's obvious they've been doing this a while, and they have a lot of bugs worked out. Okay, the patients that I see in the medical section most commonly have diabetes, high blood pressure, respiratory problems like COPD, chronic obstructive pulmonary disease, or asthma, or things of that sort.
Community involvement is a very important aspect, and it's something that we learn about at the school that I go to. And being in such a small community, it's really important to make sure that people are being taken care of. And this is essentially what RAM does. This is how people are taken care of. A lot of these people can't afford healthcare. They don't have access to healthcare. So this is the one time of year where they can come and get seen for absolutely everything, and that care is critical. So I love helping out with RAM every single year, because it's services that people in my community need, and if I can help with that in any way, then I love to be a part of it. And as an additional service of RAM, specifically this RAM, we are offering food for the people to take with them as they go. So after they come out of the clinic and they get in their cars and they're rolling back through the gate, we have all these cans of corn, and we also have additional care packages that they can take home full of rice and peanut butter, just as kind of an extra little treat, little service that we provide just as people go home.
I have been the dental pharmacist for 3 years now. I volunteer at RAM because I see needs in my community, needs in the people that I take care of at our local pharmacies, and those people mean something to me, not only personally as community members, but I want to see their health get better. I think I will remember RAM for its impact on individual lives and how it changed them for the better. I think RAM is a wonderful learning tool for our students. We see students from all different states. Just today we have Ohio State and New York, and we just see a sense of community, but not just this community. They come together and make our community better.
Okay, so we have two goals on the last day, of course. One of them is seeing patients, and that is our foremost priority. But we do also have to tear all of this equipment back down and put it back on the truck and get it back to Knoxville. But they have school tomorrow, so we have to get the building back ready for them to have school tomorrow. And so as the clinic coordinator, what I'm doing today is balancing getting as many patients in with making sure we have enough time to tear everything down, with keeping track of when all the doctors want to leave.
We want to thank all of the people that came to participate. To pull this health fair, it takes an army, and it's to alleviate the suffering of your fellow people. This is the bottom line. We want to say Godspeed to them, because eventually we will see them back. They love coming to this beautiful place, and it's a privilege and an honor for us to help the people. We'd like to thank all the doctors, all the eye doctors, all the dentists, all the medical doctors, all the volunteers that came to provide the services, as well as remote area medical.
We had a wonderful weekend here in Grundy. We saw 300 patients with over $157,000 in value of care. We just want to say thank you. We are so very grateful to be able to come here and to serve the community. We always love working with the people here, and you really make sure that everything is up and ready for us to go, and could not be smoother.